Hello and welcome to the True Man podcast, the podcast designed to create a generation of self-defined men. Today, I'm joined by Ollie Matthews, the founder of OJ Health. Ollie, it's an absolute pleasure. How are you doing?
I'm doing really well. Appreciate you having me. How are you?
Awesome. Yeah, very well. Super excited to get into this one. We've just been speaking off camera how important it is to have these types of conversations. And I think just to sort of reiterate where I'm at with the podcast, really excited to delve more into men's health. I think I've really touched a lot on well-being, and I think we'll get into how they sort of interlock. But yeah, really excited to get into the health aspect of the male psyche, if you will. But as always, Ollie, in your own words, what makes you a man?
I feel it's just being able to show up with honesty, with integrity, with transparency. And I feel it's providing for my family as well. It's a big part. And I know women provide for their family and so forth, but I feel as a man, I need to take the pressure off my wife to provide so that she has options and she hasn't got to stress about that side of things.
Awesome. And today's topic is arguably a bit of a taboo topic. It's one of those ones that sort of gets brushed under the carpet. It's one that's not sort of spoken about a lot, but let's just get into it and let's sort of really delve into it. Ollie, what is testosterone?
Testosterone essentially is a male hormone, and women have it as well. It's very important for women, but it's seen as the male hormone, and people see it as a sex hormone, which it absolutely is, but they see it as this hormone that is responsible for building muscle. It's got this connotation that it's going to the gym, you take testosterone, you get bigger muscles. But testosterone is there for good moods. It's there for your sex drive is going to be there for testosterone. It's going to help you with just general good health and good well-being. And people are neglecting it. We're seeing lower levels of testosterone than 20, 30, 40, I was about to say 20 years ago in 1980 then, but then I realized we're in 2026 and I'm turning 40 this year. Actually, in 1980, the average levels of testosterone were 21 nanomoles a litre in an adult guy. And now they're 18. They have dropped a drastic amount in that time. And we're seeing guys with lower testosterone. We're seeing puberty happen. We've got with kids that are obese having lower testosterone as a result. We're getting exposed to more chemicals. And testosterone is lower than ever. Guys aren't getting tested. And we need to do something about it.
Why is testosterone important for men?
As I said, testosterone is needed to feel good. And there's the connotation of testosterone being just for muscle building, just for some guy that wants to get jacked, just for bodybuilders, just for people like that, just being steroids is not steroids. And we need, if we look at the actual like high being 29 nanomoles a litre, just talking total testosterone, we don't have to go deep into the science of free and everything else, but 29 and low on NHS being 8, guys will start to see symptoms of low testosterone at 15 nanomoles a litre. The average 40-year-old in the UK or in the Western world is at 13.7 nanomoles a litre, but they're not able to get any intervention from the NHS until they hit 8. You can go to the testosterone clinics and pay privately and so forth, but that is scary. That is worrying to me. We're seeing suicide rates, the highest they've been for around 30 years. The most at-risk demographic are guys in their 40s. And I truly feel that the biggest intervention that will lower that suicide rate is checking testosterone and intervening when numbers are low. Awareness that guys, that if you're feeling low, if you're feeling like you're putting on fat, if you feel like you are struggling, if every day it's just like struggle to get through, if your sex drive isn't there, if you've got erectile dysfunction, any of these things, get your testosterone levels checked. We're not normalizing checking testosterone. And so many people I speak to have health insurance, but don't even get their annual health check. Okay, testosterone might be an add-on. It might be different like to get that, but you can get a full blood test for 200 odd pounds just by going to a blood test company or anything. But you can get a testosterone check for about 35, 40 pounds, a total testosterone check. A finger prick just to do that. People will spend more than that on a takeaway.
They will, yeah, for sure. I think one thing that I find really interesting about this topic, and it's something that I've had as a conversation a number of times, is I sort of remember my sort of sex ed conversation in like year 6, year 7, teacher with a banana, teacher with a condom. You'll start to grow some pubic hair in areas that you've not grown hair before. don't rape, tick, see you later. That was essentially the conversation for men. I'm aware for girls there would obviously be a deeper conversation around menstrual cycles, periods, and what that sort of looks like. Why do you think there is a lack of conversation around testosterone, both for boys, and obviously that's starting to seep into men in their 30s and 40s now?
I feel it is just that awareness that it's for one thing or two things, sex and muscle. And guys go to the doctors, they'll go to their GP and they'll say that they've got low moods and they'll get chucked with an SSRI or antidepressant sort of thing. And then they won't see the results with the antidepressant. Now, antidepressants aren't about getting high moods, or they're about, you'll get flat. You just don't get those dips. And it's not a problem with depression. It's a problem with testosterone. And then even then, going to their doctors and getting a blood test, I think it's irresponsible when doctors will only do total testosterone, not free testosterone, not checking their sex hormone binding globulin to see how much that they have there, not checking albumin levels, not checking prolactin. It's something that needs to be normalized. And the problem we have with guys, right, I've seen especially guys in their 40s, but probably more so in their 50s and 60s, is that it's not, we don't speak about health as much. I'm nearly 40. Depending on when you put out this episode, I'll be 40. In a month, I turn 40. So say I'm in my 40s. That you don't go to the pub and chat about you can't please your wife because you couldn't get it up. It's just something that people would laugh about. Women talk about these things more. Women talk about perimenopause more. Kind of normalized. Like, we've seen so many more celebrities talk about this stuff. I mean, there's been talk about prostate cancer. There's been talk about those sorts of things. And like testicular cancer, guys, check your balls and stuff like that, but not check your testosterone levels. Now, you could get into the politics of it as well. I'm not going to go into politics too much. I don't know much about politics. I know about health stuff, but you could get into like potential conspiracy theories. Is a man easier to control with lower testosterone levels? Is that why we've seen the low on NHS markers go from down like over the decades, where it's now at 8, where actually those markers are based on averages of populations. So then guys are having to get lower and lower before they get any intervention. And I feel that's something that needs to be looked at.
Yeah, I think it's just moving averages, right? I think it's easier to say this is the average, so that's quote unquote the norm, whereas it might not be the norm, or it might not be enough for that. I think there's some crazy fact around the amount of vitamins that you need, which were essentially designed around sort of World War One, maybe World War Two, of like how much sort of magnesium a soldier needs to stay alive. So they're not really necessarily the correct levels today, but it was used then, and that's sort of the average that's needed, right? And they just sort of keep those goalposts and move them for sure. I think
in guidelines as well for supplements, we've just like, I won't go into like naming all the supplements and stuff like that, but I've just launched a supplement with quite a big name, and we were looking at how do we get different things like magnesium in there. You couldn't chuck like, I want people to be on like 300 to 400, even 500 milligrams of magnesium, especially when taking TRT. That can deplete your levels of magnesium even more. But trying to put that into an all-in-one supplement is pretty impossible, because you still have to work on what does the average person need? Can we bump some things up? But also the guidelines won't let you as well.
Yeah, it's there is a little bit of a pushback on all of these things, and I think this is probably where we're sort of going to get into this now. I think it'd be really useful to sort of get an understanding of your story and how you've sort of become so knowledgeable around testosterone and sort of TRT, I guess.
It's I'll try and make it it's a short, long story, right? That growing up, I was growing up in a room with black mold, which in itself could have been something that lowered testosterone. But then going through puberty, I was a bit more overweight than the average boy. But I lost my dad when I was 15 through a stress-induced stroke, which then sent me down the route of I can get comfort food, I can get comfort from food, I can eat and eat and eat, I can go around my nans and have loads of sugar and all this sort of stuff. And then in my early 20s, I dropped like 100 pounds to compete in bodybuilding. And at the time, that was natural. And it was great. I was competing, but I always had these signs of low sex drive. Went to the doctors with low moods and couldn't sleep. They gave me Zopiclone, highly addictive drug. For someone which now have been diagnosed with autism and ADHD, that was kind of irresponsible. But then they also gave me Viagra. I was in my early 20s. You're not going to investigate why there's a problem there? And then they also wanted to put me, I had like amitriptyline for migraines, but then they pushed up for a dose for more of an antidepressant style dose. But it wasn't enough to just compete naturally. I wanted more confidence. I wasn't confident in my body, so I went down the route of steroids. And it wasn't to the dose of that I see a lot of people on, where it's like 1 gram a week and all this sort of stuff. Most testosterone I took was like 350 milligrams a week. Then you start putting other things in, trenbolone, masteron, these sorts of things, and other things. And it does become addictive. Those people that tell you steroids aren't addictive are the ones that are on steroids trying to justify not coming off. Because although psychologically it's meant to, the studies don't really show the addictiveness, that feeling of, oh, I can recover. I feel like a Superman. I'm putting weight on. I'm gaining muscle. I've got strength. I've got all these things I can do is great. So I went down that road. I competed, assisted, and it still didn't help me with my confidence. But cycles got longer, time off got shorter, so your body wasn't recovering. And then I tried to come off completely, and that was horrible. I came off, and basically that was not a good place to be in. I went to rock bottom testosterone. It wasn't recovering. We went onto TRT, and that helped for a bit. And at the same time, I was going down a journey of getting into the fitness industry, being a personal trainer, then becoming a performance nutritionist, working with some really high profile athletes when it came to Tour de France, Olympics, world champion triathletes, which was great. And it led me into functional medicine, which I say is basically trying to get people from sick levels to optimal levels, using as much nutrition intervention, using nutraceutical supplements as an intervention, but also supporting where they may have to use medication, but trying to get them off that medication as well. And that time was amazing. And this is trying to intervene my health journey with my educational journey and business journey at the same time. I started working with entrepreneurs, and I worked with a guy who was Taylor Swift's first manager, Rick Barker. And I saw that my dad's story, I couldn't help my dad, but I was standing with Rick in his kitchen in Nashville, and his kids were there, his wife was there. And I realized I couldn't help my dad, but I could help this guy. I could help entrepreneurs. I could help guys not die before seeing their children grow old. So I just dived deep into functional medicine. I dived deep into what can I learning blood work, learning what other tests we can do, hormone tests, gut tests, all these things. And at the same time, being on TRT, and not every guy will lose their fertility. And something to point out as well is that I don't know how fertile I was before. I could have had 0 sperm count beforehand. So when people say it's something which your sperm count will drop, high chance it would do. If people are going to get on TRT, I would recommend free some sperm. There are also protocols that if you follow people like Dave Lee, and he's got some protocols which I've implemented with clients that have actually helped people with fertility to have children while still on TRT. But I couldn't have a kid. I was with my wife for multiple years and went to the NHS because we wanted to do IVF. Had to come off everything. If not, we wouldn't have got the funding, which is fair enough. And my levels went from 22 nanomoles a litre, normal levels, to 1.1 total testosterone. And at that point, it was a living nightmare. It was not something I would wish on any person. My business was thriving. I was traveling the world to speak, go and stay with clients, to implement things. And then my body was basically giving up. You're training right. You're pushing yourself in training. You're eating right, but you're putting on fat and you're getting weaker. It started improving testosterone and then started dropping again. So when we got to the point that we could freeze sperm, now they told me it would take a good 18 months to get to the numbers I needed to freeze. With functional medicine, we'd done that in 6 months, but they wouldn't freeze until 9 months. So we, after that, froze it, went back on TRT. And I honestly feel that is the thing that saved my life. Because when you're down at 1.1 total testosterone, one, you're not creating any estrogen, like pretty much 0 estrogen. And that helps you with brain function. It helps you with joint pain. It helps you with all these things that we forget about. And guys demonize the estrogen levels. And it also is helping you, like you're trying to have a kid. And you're on 0 testosterone and you're trying to have a kid before going down IVF, and you basically want to have sex, but you haven't got the drive for it. And you've got erectile problems as well because you haven't got the testosterone there. It's a horrible place to be. So luckily we've got a supportive wife. We'll go through it. My daughter is just over a year old, which is amazing to look at her and think the journey we've been through. But that has put me on this mission that I want to help 1 million dads not die before seeing their children grow old. And to be fair, it's not just dads. It's that men's health needs to be spoken about. Testosterone replacement therapy is not steroids. It's a life-saving medical intervention that too many people are abusing. People in the gym that are taking too much, that aren't getting blood tests. People saying go on a mil a week at 250 milligrams. That's a steroid dose. I don't care what anyone says. Well, actually, I spoke to a doctor with a TRT clinic that I consult with, and I think in 1,000 odd cases on average, he's had one person that they've had to go over 200 milligrams a week. It's very if you're genetic outlier, you might need a bit more. It's highly unlikely you're that person. You're just using steroids and trying to hide it.
So one thing that you mentioned sort of at the beginning was obviously doctors throwing medication at you when you were in your early 20s, and also that a lot of men don't talk, and sort of this is where I guess this black market for the magic pill comes, right? So we have steroid abuse, big rise in peptides at the moment is sort of the new trend of where it's going, or jumping onto TRT and sort of just paying for it without it. So what are the negatives to sort of self-medicating and sort of jumping straight onto testosterone replacement?
I think, and I'm someone, I did self-medicate at first, so I didn't make that clear. And I self-medicated for a couple of years before I went to the clinic. It is so hard to justify spending like 150 odd pounds a month when you can get 10 mils of testosterone for like, I don't know, 25, 35 quid, which that then lasts for, well, I take literally like 20 milligrams a day, which is like 0.1 of a mil. So that's going to last for quite a long while. So it's so hard to justify spending that extra money. And it's even hard to justify when you feel okay to still do tests, and to still do tests every 3 months, every 6 months doing full tests, every 3 months doing like a smaller hormone test. And don't get me wrong, like the other thing, it's hard to say, feel good, I'm going to push a little bit more. It's hard to resist that. And actually, if your testosterone is good, I know 100% with 100% certainty, I could get to where I am today because I have friends that have pushed themselves naturally just by optimizing their testosterone. Have friends that have never gone high on testosterone, just been on TRT. They're in similar shape to myself. I know I could get to where I am today with the same consistency. Bearing in mind, I've been training since nearly 20 years now. So, and that's consistently doing 3, 4, 5 sessions a week. One time I got obsessed and done like 6, 7 sessions a week, but it's consistency over perfection. So I could get to where I am without that testosterone. And it's so hard because it's expensive nowadays. Just life generally is expensive. So there could, I'm not saying it's the right thing to do. I'm holding my hands up and say I've done it. There could be no drawbacks at doing it. If you know you're getting a good testosterone supply. But I suppose the drawback is that how do you know that source isn't going to change their supply? How do you know that underground lab is going to be actually following all the hygiene levels they need to? How do you know they haven't added different fillers? How do you know they haven't changed their carrier oil, which then you react to? Are you injecting the right way? How do you get support with injections? All that stuff. That's going to be, when we look at that. But when you then go to a lab and you get actual medical intervention from a doctor, and going to a good lab as well, like there's some labs, one lab which has got a massive marketing budget, massive podcast, get celebrities left, right and center. I'm not going to name any names with it, but they're then going down the testosterone route, and then they'll chuck in other things. Like, oh, well, you want to have kids further down the line? We'll chuck HCG in now. There's no guarantee that's going to keep your fertility on, and actually long term could desensitize things. And you could put in HCG when you want it with HMG or FSH and work on a different protocol for fertility back when you actually want to have a child for like 6-9 months before. And it's finding that right lab that will work with you as an individual, because we also have lab numbers, we have lab markers. But me as a practitioner, if I'm working with someone, it's not just about having the right lab markers, it's also about having resolution of symptoms, resolving symptoms. And every single person was different. Someone might resolve their symptoms at 18, testosterone. Someone might be at 29. I've seen people that are natural at 39 nanomoles a litre. Now, if we're doing blood tests regularly, if they then come into their 20s, they've dropped like 10, 12, 13 nanomoles a litre, that's going to show signs of lower testosterone. But then they get their bloods done and they're shown in the normal levels. Oh, you're absolutely fine. They've dropped. Why have they dropped? Okay, we can't medically intervene at that levels. The guidelines won't let us, but why have they dropped so much? And I'm talking guys in their late 40s and 50s that have still got very good levels of testosterone.
So what are some of the ways that you can naturally boost it? So say you're in those sort of normal levels, but like you say, so I guess it's probably worth maybe just explaining how testosterone naturally decreases. I think that's probably something that's worth mentioning before this, like, because you said those sort of big drops. So you may have been in your 20s in the high 30s, 40s of testosterone, and then suddenly it's dropped to 25, which is a big drop in numbers. So sort of explain how testosterone naturally decreases, and then also maybe touch on some ways that you could look at starting to bring it back up as you start to age.
So something that isn't talked about much is andropause. And as soon as you say the word andropause on social media, you get a lot of women say, oh, men don't go through menopause or this sort of stuff. The only similarity between andropause and menopause is hormones. Now, not every guy is going to have their testosterone drop, but a lot of guys between 25 and 30 years old, their testosterone is going to start to drop around 0.4 to 1.4% every year. So when they then get into their 40s, they've got 10, 15% less testosterone than they did in their 20s. And that's if they're even following like good guidelines. They still might drop. And that's where we look at their plastics, pollutants, and pesticides. Those 3 Ps are massive. And if anyone's heard my podcast or spoken with Dave Lee, they'll hear him talk about those things. And those things, like endocrine disruptors, are hitting our hormone systems left, right, and center. You're going to see drops in that. Drops in testosterone can happen with problems with sleep. So we're seeing lower duration of sleep on average. People staying up later, waking up earlier. The 9 to 5 has become like an 8 till 6, but then could have an hour or so commute each way. So it's a 7 till 7. We're waking up earlier with it. We're on screens later, blue light disruption. So we're getting less quality of sleep. The study has shown that if you get 6 hours sleep or less for just 2 weeks, that can lower your testosterone by around 10 to 15%, which is worrying. How many people are getting 6 or less hours sleep? And this is someone with a baby as well. But you've got to try your best to get sleep and get good quality sleep. Then when guys actually conceive, testosterone lowers as well. Only a little bit, but it lowers. So you can then become the nurturing guy rather than the person who wants to start a family. Problem is, guys then go down that problem with sleep. They start eating rubbish. They stop training. And then levels never recover. So I would say those are the things that your testosterone is going to drop in those levels if we're not really focusing on pushing it back up. Now, I've seen guys in their 40s, guys in their 50s go from like 12 to 18 total testosterone. And again, I use the total testosterone just for simplicity to say where they're going to. Guys that are really pushing their testosterone up from starting to implement things. And there are 4 things that we look at, and I look at in my clinic, both working with people before TRT that want to get their numbers up naturally. So they may not have to have TRT and they could push it for another 10, 15 years before they use it. And also guys that are on TRT are not getting the results, because if you are to take TRT as actual testosterone replacement therapy, you need to be putting that testosterone into a body that deserves to have high testosterone. There's no point going out and getting wasted every week with your mates. There's no point eating loads of crap. There's no point getting 0 sleep. You still need to be working on the healthier stuff. If not, you're going to get loads of problems with estrogen. You're going to get all the side effects and you're not going to get the results. You're just going to be wasting money, whether it's underground lab or with an actual clinic. So the 4 things that we work on is that the first thing is good nutrition to support your gut health, to allow good absorption and creation of nutrients. We're not getting enough cholesterol in, and doctors chucking medication for cholesterol left, right, and center. If we're not getting good cholesterol for the building blocks of testosterone and other nutrients for other hormones as well, we're not going to be able to have good levels. People trying to build a house and they haven't got enough bricks. That's what we need to have there. We need to make sure we've got that sleep in there. As I said, waking through the night for the toilet is common, not normal. We should be able to sleep without waking up, definitely without waking up multiple times. Usually we're waking up or we're going to the toilet because we're waking up, because of cortisol dysregulation, blood sugar dysregulation. We're not waking up because we need the toilet. There's a difference. What's common is not necessarily normal. Then the third thing is not just doing strength training. The amount of times I see people and their hook on their reels on Instagram is like how to get in healthy condition, how to drop 20 pounds without doing any cardio. It's not really a responsible thing for someone in a health industry to do. We need to be both strong and cardiovascularly fit. There's no point of getting loads of muscle, going up the stairs and being out of breath. But then there's also no point of being able to run an ultra marathon and you've not got no muscle tone or anything to be healthy. We need to have good levels, and we're in a world of obsessions, of a world of dopamine releases. So we could get into, I don't feel bodybuilding's healthy. Absolutely don't feel the extremes. I don't feel that's healthy. I also don't feel doing high rocks or CrossFit week after week after week is healthy as well. So it's a good level of strength, a good level of cardiovascular fitness. And the 4th thing that we miss a lot, and I work with a lot of people on, the most important thing is test, don't guess. So get your bloods done. Don't just test testosterone, test your red blood cells, white blood cells, test your iron, cholesterol, your full hormone panel, as we said about liver, kidney function, glucose, inflammation, thyroid, all these things. Test them regularly. So you know exactly where your body is deficient, vitamin D, if you've got nutrient deficiency anemia, have you got high ferritin, which is then going to cause, is a sign of inflammation going on in the body. Where do we need to work? Have you got thyroid antibodies? You've actually got Hashimoto's thyroiditis going on. So we need to work on the nutrition then and so forth. And one thing I've seen a lot with people when I do a test called the Dutch test, dried urine test for comprehensive hormones, is that people talk about cortisol being a problem. This is a test that you can do a cortisol awakening response with it. It's a urine test for hormones, and we're supposed to have this kick up of cortisol in the first hour, and then it starts going lower for the rest of the day. The amount of times we see a low cortisol awakening response and they're struggling to get out of bed, or people are producing enough cortisol, but they're burning through it so quickly. And as a result, their body's not then got the resources to then, because it's trying to keep up with the cortisol demand, it's not then got the resources to actually create the testosterone as effectively as it could. So it's not just, even if your testosterone is low, why? So many labs are not doing the test thoroughly and looking at why. They're just seeing people as a number to say, oh, I could get that person on testosterone therapy. I could get some money out of them, rather than let's see if we can do some more things before they need to have testosterone therapy, so they can not have to inject themselves, not have to put cream or gel on multiple times a day, so they can actually still do things naturally and push things forward.
Yeah, I think it's. I think we're in a society of looking for that magic pill. We've obviously seen that with Ozempic and those kind of things. But when you talk about your sort of own journey and how it started with steroids and taking them, but still not feeling like you were big enough or strong enough and wanting to do more and more and more, it was just tackling that issue, right, of that little boy that still didn't feel confident and didn't feel safe in his own body, right? So if you don't solve the problem, the pill will not solve you mentally.
Exactly. And I feel that's something which, it's another discussion, but looking at GLPs and weight loss injections, I think they're a great medication if done right. And they can be really good at very low doses, taking that edge off the food noise and looking at cholesterol, looking at inflammation levels, looking at mast cell activation and stuff like that. The problem is, again, we see clinics prescribing them left, right, and center without telling people you need to eat enough protein and you need to be doing strength training and we need to lose weight a little bit slower. And the body will pretty certainly respond better, because we see a lot of people, not everyone. So when people jump on you, when we say people put on weight after they've stopped the medications, we see a lot of people put weight back on over the next 6 to 12 months. A lot of weight, because they're not looking at those underlying habits.
No, I think it's it's one of the biggest things, right? Is like when I started all this and all of these kind of things, it was like I just looked at self first. I didn't look at therapy, didn't look at antidepressants, didn't look at anything else. I just looked at where I was and what I could change and what was in my control first. And I think that's the most important foundation, right? Is you have to be in the right mindset, in the right space to move forward. And almost want that change, right? Like not want to just be like, oh, I feel crap. What's the solution? It's like, I don't want to feel crap anymore is probably the most important sentence before you actually start exploring what you want to change.
People need to know who they need to become or want to become, because so many people get attached to their ailments. Like if I lost 100 pounds, I went to music college. I used to DJ. I used to rap. I used to produce hip hop. We used to get takeaway every single night. The people would know our order beforehand. And I would have late nights and then I'd go and like survive on Red Bulls and like big bags of like chili Doritos and things. But I had to change a lot of my peer group. I'm connected with a lot of them still now, but I'm only friends with a couple of those people still, because they don't have that same lifestyle change. But you then get a lot of new friends and a healthier peer group. We look at that saying of like, you're the average of the 5 closest people around you. And it's so true, but you have to be prepared to change those people. And a lot of those times, are those people even serving you? Which is like going into on a deeper level.
Yeah. You see so many people stuck and you can see why, but again, it all comes down to, you have to want to make that change before you can make that change. I think is probably the biggest thing I've learned from us.
I get wives say, oh, I wish my husband would listen to you. I've shared the content. You don't hear from the husband. And I know when my wife tells me to do something, it takes a few times before I even do it. If I actually do it, I might get my back up if she's told me to do it. And I'm like, I don't want to do it now. So yeah. I wish guys would listen to their wives, be a lot richer.
For sure. One thing that I find really interesting is ways that men's testosterone is lowered. So you spoke briefly about how once your partner's pregnant and your baby's born, your testosterone naturally drops. I'd just be curious to know if you'd ever had that conversation with a health professional during your wife's pregnancy?
Never. To be fair, like a lot of the conversations, I had a chat with Talking Therapies about the experience during pregnancy as a man, and how going to the scans, like every scan, and this is with NHS where I am in Norfolk, so it may be different in other areas, but I got asked if I was a dad every single time I went to the scan. Never got asked my name on that point. I just got asked if I was a dad and all that stuff. And like, yes, it is. Like, my wife was carrying our baby. She had to go through a lot. And her body changing and everything else, C-section and stuff. But there's a lot of pressures then on the man of wanting to provide and all this stuff. And then again, like we look at paternity, running a business. I got like 2-3 days. Luckily, she was born on a Friday at midnight, so there was Saturday, Sunday. But then at the Monday off, I was back doing calls again on the Tuesday at lower levels. But like paternity wasn't really a thing unless you're in a company and so forth. Like that's going down a tangent with that stuff. Even things like the medication that is, or the vitamins that are given, take folic acid. A lot of people can't absorb folic acid and need methylfolate, and because they've got problems with the MTHFR gene. They're given the vitamins that then cause more pre and postnatal depression. And so I was having those sort of conversations with the midwife, and we could learn a lot from you with this stuff. But there wasn't, I think I got asked once about my own health after my daughter was born. And I say, I'm not saying that I want to take the whole thing away from my wife. She was recovering from big operation and having a C-section and having a baby and then trying to look after it while I'm doing work stuff. But I don't think there's even high levels of awareness about testosterone levels dropping.
No, I think it's you said it yourself. We can learn a lot from you, right? Was what the health profession said to you. It's probably unknown to them as well. And it's one thing I'm really interested in pushing and sort of opening the dialogue is getting boys and young men as well to understand testosterone, and then obviously that will filter into later life. I don't want it to get to a point where we're at now, which is essentially people living for longer, living more active lives for longer, living more, I guess, youthful lives, right? Which is probably why sort of lower testosterone is becoming more of an issue, whereas it was like you would just put your gut on and you would live as a man that had done his time youthfully. Whereas now you've got guys in their 30s and 40s that want to do marathons, they want to do high roxes, they want to do Ironman, and they are confused as to why they can't leap out of bed anymore as they could do in their teenage years. So I think that's a big part of it. But yeah, there's a serious lack of conversation around testosterone, like we've touched on, because it's almost like this anti-feminine hormone where it's like, if you've got testosterone, you're toxic.
Like women need testosterone as well. I think doctors are responsible for just prescribing estrogen with HRT without doing blood tests, when progesterone and testosterone need to be checked, and testosterone could actually have more benefit. But that's another story with that. But guys chatting about it, it's just, women talk about menopause, they talk about perimenopause. It's become a normal thing. And I think as well that, and it may sound controversial, but a lot of women that say they're going through perimenopause aren't actually going through perimenopause. They've got a lot of nutrient deficiencies. And if we've done a lot of deeper testing, again, it costs money to test. People aren't testing. And it's something which we can work on. I've had someone in my clinic a few years ago, I used to work a lot on women's health. Someone say, they've gone through menopause. We worked on a lot of nutrient deficiencies and they started having periods again. So that's where we need to be checking these things. It's the system, right? And we're not going to change the system overnight. It's a system where you change something and it doesn't get implemented until 10, 15 years later. So we need more private healthcare. We need that to be a cheaper, more accessible to people. My goal is that if people can't afford to work with me, I've put out enough information for them to do it themselves. You can look at my videos, you can look at my YouTube, you can look at my content, and I need to go and do this. The difference of working with you one-to-one is just more individualized, doing the bloods, you go and do this, and then the accountability to actually implement afterwards. But health can be very expensive. I've done some testing with someone, and I'm lucky to work with some celebrities, and they've got big budgets. So we can do like £1,500 worth of testing on nutrient deficiency tests, gut mapping, and different, like the hormone tests and stuff I said, along with blood testing. We can do those things. It's great. But a lot of times as well, I say to people, when we test, we need to know what we're looking for. What's the point of testing just because you got the money? Just because you can do something doesn't mean you should. What are we going to get those results on? And what's that going to change with our protocol? How are we going to move forward differently and so forth? We need to look at those things. If not, what's the point? Because also tests apart from blood tests are pretty quick to turn around, but other tests take 3-4 weeks in some points. So that's another thing to look at. I get a little bit frustrated when I see practitioners, not just we're looking at GPs and stuff, but practitioners, that I make my money from coaching. That's where my thing is. People that are clients of mine that get coaching, they get their tests for cost price. They get their supplements for cost price. Literally doing the same thing as I get frustrated with doctors doing medication because of targets and because like they're not looking at how the lifestyle intervention. Fine, then go and make loads of money off of supplements, commission of supplements. I worked on a supplement specifically to help with people. That's a bit different with natural just lifestyle intervention. But things that come up on blood tests that they need to then have, I'm then doing exactly the same thing as doctors if I'm making like 25% commission off of each vitamin B12 that I sell.
Yeah, I get it. If there's a man listening that goes, I like what this guy's saying, I understand what I need to do, what sort of things would you say to them to get started, and also to start encouraging those conversations with their peers as well?
Honestly, like the conversation thing is that our body is doing things inside. The environment is doing things to our body. It is normal, and I say this, normal, not common. It's normal for our body to be changing, but it's not normal to be changing at the rate that it's changing when we look at aging. Aging is steady. We should be able to live a very good life, and then health just drops off a cliff or something. I don't know what it is. Like, it shouldn't be this decline where it gets into our 40s and 50s. And now I see people I went to school with and I'm in the same year as me. And I'm like, oh, you're turning 40. They've got all these health problems and they look like they're 55. They look like they're 60. And that it's not because you're weak that you've got low testosterone. It's not because you've got no discipline. It could be the environment around you. It could be the job. You're doing shift work. It could be that I've had someone who's an artist that has been exposed to chemicals with painting. Chemicals like being a groundsman in a golf club, it's been shown to be very carcinogenic, and then the chemical exposure is actually, and that's very specific. But when we look at like the data on it, it's been that being a barber, like this exposure to chemicals has been very carcinogenic, and then also exposure to endocrine disruptors. So it's something where we can chat, we can support guys, and we can point them in the right direction. Now, as for what to do, there are two questions that I say to people. They say to me that I need help with health. They talk about improving nutrition or this sort of stuff. But when people say I eat a healthy diet and I see their food diaries is a little bit different from what I class as a healthy diet, which is individualized compared to what a lot of people say. But the first question I would ask someone is, what is one thing that you could add to your life right now that would improve your health? The second question is, what is one thing you could take away from your life right now that will improve your health? I guarantee every single person, they're being brutally honest with themselves, knows the answer to those two questions. Start with that. If that's, you need to add a multivitamin, add a multivitamin. If that's, you need to add some walks, add some walks. If it's, you need to take away alcohol, take away alcohol and see why you're drinking. If it's that you need to take away so many takeaways, take that away. It's all these things where we know if we're being brutally honest with ourselves, what are those two things? Start with those, be consistent, stop trying to do the sexy stuff with loads of ice baths and loads of sprints and the extreme things. Do the foundations, do the basics, and you'll get so much further ahead.
Amazing. Ollie, in the men's space as a whole, what do you like right now and what do you want to see more of?
I like that there's becoming more awareness around testosterone. Whether it's all good or the right stuff, I feel that's a great thing. I don't like, and I say this as well with my stuff, is that go and do your own research as well. Just because I'm qualified where I am, I'm insured where I am, and I've got however many followers, you see people with 100, 200, 300,000 followers and they're putting out absolute rubbish. Do your own research. Don't just take someone because they're shouting on Instagram. Don't just take their word as gospel. Actually, go and do your own research and see what you need to do. Now, I feel that that's not going to get any better anytime soon. We're getting more and more influencers and so forth. And it's something where we need to work on. The industry isn't as regulated as it could be. We're seeing celebrities that have just lost weight that then get paid a lot of money and so forth. So it's like, social media is a great thing. It's also something that I think is a really bad thing as well. I run my business of it, so I need it for my business, but it's something where regulation would really be more beneficial.
Awesome. Ollie, thank you so much. It's been an absolute pleasure to have this conversation. I'm glad that we have had it. If people have liked what they've heard and they want to find out more, where's the best place to find you?
I would say just on Instagram, Ollie with an IE, Ollie Matthews Health, and just drop me a message, say that you've heard the podcast, and if you've got any questions, just fire them over there.